Thank you so much for such a nice introduction. First of all, I would like to thanks HMA for giving and Noble Hospital for giving me an opportunity to be present here and to start the conference with my first lecture. So, post-COVID especially, physiotherapist has gone a different boom. But when I started my career at Hadapsar in Noble Hospital, Dr. Jip Mane sir has given me an opportunity to lead the department since 2007. And I was quite young at that time. Still I am young. So, uh, Dr. Lingay sir is there. He actually bring me from Dinath Mangeshkar to Noble Hospital. So in my last 15 years, what I have changed here, I was one of the first physiotherapists. Dr. Parin Patil is also there. We both started the physiotherapy here. And in last 15 years, now, my field has grown from a single bachelor degree to a post-graduation in nearly 10 to 15 fields. And many physios are going for PhD and further research orientation. So commonly we are aware with musculoskeletal, cardiopulmonary, neurology, pediatric, sports, community rehab, and many more. When we started, we are the one of the only physiotherapy center at Hadapsar, but now minimum, if not more than 30 physio clinics are there. And if you see in a circle of 5 to 7 kilometers, nearly 60 to 70 therapists are practicing. So this is how the field has grown in last 10 to 15 years. So now since many specialties have been created, so many research and many new modalities and new type of exercises have been introduced. For a neuro perspective, the functional electrical stimulation, see we don't have much option if a patient is totally paralyzed. So for FES, it has done an excellent results in hemiplegia, paraplegia, quadriplegic, and literally patient can walk through using FES. So it is a very upcoming technology. Similarly, we are going to see about the gait and balance trainer, how a paraplegic patient can walk using various assistive devices we can provide them. From curative to a regenerative field also we have entered. In a laser therapy, we are now using class 4 laser at Noble Hospital. Induction therapy, so the MRI is not just for the diagnostic purpose, but we are using MRI, same technology, MRI for rehabilitation purpose and reducing pain and many other conditions. So induction therapy, it uses around 3 to 4 Tesla MRI. Similarly, we have a magnetotherapy at Noble Hospital, which is a very small dose, 0.018 Tesla. So that we use mainly for regenerative therapy. Matrix therapy, TECAR, spinal decompression. Spinal decompression again is very common. We are using for early to moderate level of PIVDs. Now this we are recently introducing a small new machine, iGet therapy. This are saying that from an ortho perspective, we are now developing the field in a neuro rehab basically. So we don't have much treatment available for post-neuro surgery or post-stroke patients. So these are the few machines which are really helpful in improving the neural condition after any stroke or a neuro assault. This is like a functional electrical stimulation. As the name itself suggests, this is a functional rehab. If a person is not able to make a fist, so machine will send a current in such a way the patient will be able to make a fist. So normal stimulator will activate only one part of muscle, but they activate a group of muscle. And this, if we use repeatedly, this helps to form the new pathway in brain. So in a longer period, a patient gain these movements. So it's not you have to always use FES, it's but just to improvise the connect between the muscle and brain. And believe me, this is a paraplegic patient who is able to walk. with the gait trainer. And these technologies are slowly introducing in India, and it's not that uncommon now. And mobile hospital is has as a physiotherapist, I always feel very proud here. We have been introducing many new techniques in the field of physiotherapy in our area. So not only we are the first to introduce matrix therapy, shockwave therapy, magnetotherapy, decompression units, class 4 laser, but also one of the new many of us have been seeing is chiropractic and osteopathy. So chiropractic in India, it is not a regularized branch. It's not even a single college in India which is providing a chiropractic facility, a chiropractic treatment, but it's very common in USA and Western countries. USA, chiropractic and osteopathy, they are equivalent to like a 4.5-year course, and osteopathy is in fact equivalent to MBBS there. But in India, only 2 osteopathy colleges and not a single chiropractic college is there. So most of the doctors who are using the name chiropractic is just because we don't have any regulation on chiropractic. So we are, but like I have done a postgraduate diploma, not from India, but you have to do it from the Sweden. So I will just brief you about what is chiropractic and osteopathy. So I will just fast forward to this diagram. So what this is, since every part of our visceral organ and your musculoskeletal system is provided by one or the other spinal nerve. So if you correct any blockage in the nerve, and if you improve the conductivity of the nerve, or if you improve the functioning of the nerve, you can improvise the function of that particular organ. Suppose a vagus nerve which can get trapped in C1, C2, and it's provide a large part of our visceral system. So if the vagus nerve get affected, it can affect the visceral system. So patient may have a palpitation but no other clinical sign showing what is the cause of palpitation. So palpitation, increased heart rate, light form acidity, these are the common symptoms which can have. Similarly, all other organs, all the visceral organs like lung, pancreas, kidneys, they can get affected with one or the other spinal nerve getting affected, or cranial. So chiropractor and osteopathy, what they say is, if you correct the blockage in the vertebral column or sacral, cranial or visceral organ, so that can improvise the function. That's the basic principle they use. And second is, every organ has a anatomical position, and it has a significance of that. If my kidney has been given a proper anatomical position, if it's not in that position, the functioning of the kidney will get affected. So if the kidney has to work properly, it should have a proper anatomical position. That's as per the osteopaths. So they work to regularize the position of kidney. So they have techniques which through visceral mobilization, we can correct the position. A small defect, a small disturbances in the position of a kidney can affect it. But as a physio, I am not interested on the visceral aspect of this. I am just considering myself to be on the muscular part. So if you go through this diagram, you can see a small pronated foot can cause headache. So this is the chain we have to look after. A small pronated foot can lead to a rotation in the tibia, which can cause rotation at the hip, which can cause pelvic tilt or a ilium anterior. That can lead to some kind of scoliosis or lateral curvature at lumbar vertebra. To compensate that, there will be opposite thoracic rotation, and ultimately your C1, C2 will get affected, and that can lead to headache. So this assessment I learned after doing chiropractic. Otherwise, we were generally a very localized way of assessment. So when a patient comes to me or comes for any physiotherapy treatment or chiropractic treatment, we try to assess from head to toe. So this is the bony and simultaneously we can see the muscular involvement accordingly. So a pronated foot can cause not even your arch pain, or it can lead to the calf, IT band, hip joint, iliopsoas, paraspinal muscle, quadratus lumborum, and so forth. So this is a new way of assessment, or a better way of assessment. So this has improved my skill after doing a course of chiropractic. And now it is becoming a common way of assessing by all the other physiotherapists. So as a physio, we use chiropractic and osteopathy for common orthopedic conditions. So like joint pain, neck pain, joint stiffness, tension headache, thoracic pain, costochondritis. But there are my colleagues who are using a visceral osteopathy, which is giving them a good results in other stream, like especially for women health, you can see the menstrual pain, irregular cycle. But I am not. We are not indulging in that field. So they do have different techniques to treat. So few are like muscle energy techniques, manipulation, strain, counter strain, myofascial release, lymphatic drainage, cranial therapy. So chiropractics has greatly helped. It's of a great help if you are very well averse with the biomechanics and you are averse, very well adapted to the muscle and the joint anatomy. If simply going to any chiropractor and making some noise, correct joint, it's not going to solve the problem. And many people are just for marketing purpose are using a chiropractic as a marketing tool, but it won't give you more than a psychological effect if it's not done properly. There are many advantages, many recent equipments which are coming up. So one of the thing which is we have derived from lithotripsy is shockwave therapy. Earlier it used to commonly for kidney stone, but now we are using it to break the muscle stone also. So shockwave therapy are nothing but the acoustic waves which carries an energy and can propagate through the tissue, and while passing through the tissue, it creates many positive responses, and which helps to not only reduce the pain, reduce the spasm, reduce the trigger point, but some regenerative effect also. So for normal conditions like trigger point release, partial tear, and even early stage AVN, even grade 1, grade 2 AVN also, it has very good effects. Sports injuries, shockwave gives quick results. So this is just a brief how I will treat a back pain patient at Noble Hospital. So right, as I told you, we start with ankle. So we'll not only assess the ankle, then we'll assess the pelvic position, the lumbar, the thoracic, and even the neck. So wherever we find the defect, we try to correct it by manipulation, or if muscle is too tight, we start with some soft tissue mobilization. Like for this patient, I found out the QL, quadratus lumborum, was quite tight, and along with quadratus lumborum, his gluteus medius and minimus were tight. So we try to release that muscle first, and then some pelvic and lumbar corrections. And so after or before this, if the muscles are too tight, we generally give a matrix therapy treatment to release the muscles. And after, if the muscle is deep, like quadratus lumborum is quite a deep muscle to treat, so we give, along with exercises and MFR matrix therapy, shockwave therapy also to release the deep muscles. So this is what, there are many points, but my time is eating over and I think I should stop here. So Noble Hospital is coming up with more physiotherapy clinics. We have already started 4 physiotherapy clinics in Hadapsar and around in the surrounding areas like NIBM and Koregaon Park. One we have in Amenora and one in Magrapatta also. And here we have tried to give the latest advanced treatment protocols and modalities and treatments. Thank you so much.
Sir, many females comes with the low backache or urinary incontinence, especially after ANC or PNC. So, any role of physiotherapy in that?
Yeah, ma'am. Basically, what the problem post pregnancy comes is because of the pelvic diaphragm, which becomes very slack and very weak, and it affects your core muscles also. And this is the one of the common cause of having a primary also urinary incontinence. Now we are seeing a patient in the age of 25, 20s and 30s coming with a urinary incontinence because of the weaker pelvic floor. So if you give a good pelvic floor strengthening and core activation, so we can definitely solve this problem.
One more question, sir. Actually, after in medical treatment or surgical treatment, role of physiotherapy plays a great, in the prognosis. So, if AVN patients comes to the surgeon, then the choice of the treatment must be a hip replacement. So, here any role of physiotherapy of AVN hip?
So, sir, in a better position of answering it. As you know, AVN has 4 stages. So early 1 and 2 grade, definitely physiotherapy, and what I said, just shockwave therapy, and just I want to show you one photo of this, magnetotherapy. So it's like an MRI machine only. It's a small dose MRI machine. So this machine, they just help to keep the patient pain-free and mobile for a longer period of time. So we can postpone the surgery, but cancelling the surgery is a tough challenge.
No, that's correct. I want to add a few things to the madam question. Every AVN doesn't need a surgery, first thing. If the patient is mobilizing very well, and if the patient is doing the squatting and their daily movement, if they're having the night pain, that is my indication for starting a treatment. Okay? So first thing, if they're doing very well, then I give them hydrotherapy and I ask them to do the cycling. And definitely physiotherapy works very well. So ask them to strengthen their hip muscles. And because of COVID, there is a rampant increase of the AVN in all our clinics, whether it's a GP clinic or whether it's orthopedic clinics. So definitely physiotherapy and your conservative treatment works very well. I have few patients, and alendronate is one of the best medicine which we are using regularly for every AVN patients. So that works. My question to you is, what is your take on gait assessment for any patient coming for knee or hip problem?
So, I've told you we start with ankle assessment. That's a basics. How we walk says many things to us. Even if a patient walks, there are many equipments or a force plate have come for gait assessment. But even how you walk, that shows what kind of problem they may have. So, if patients having a right from the arch positions to the footwear assessment. So footwear assessment gives you a better indications what kind of gait pattern he has, and definitely improving that can improve his not even knee and hip problem, but even the low back pain also.
Yeah, that's correct. Because of the gait cycle, if you assess the patient's gait cycle, that will give you a lot of information. Because patient will come to you with a knee or hip problem, but when you start assessing, if the patient he has shown a very good diagram. Patient is having the pronated foot. That pronation, if you correct it, that will change the whole mechanical axis. It's like hip center, knee center, and ankle center. They will come in one line, and that will help a lot. As he mentioned clearly, I normally check the patient's footwear. That gives me huge information. I ask them to take out the footwear and walk. That gait cycle we are doing in Dinanath now. So lots of patients, before any patient coming with the osteoarthritis, we are sending them for gait cycle first. Whether it's old, and we are doing a study on that because that helps a lot. Because there is a paper which came on the gait cycle and knee osteoarthritis. If you correct the gait cycle, knee osteoarthritis, their weight bearing, if you change the weight bearing zone, they get a pain relief.
Sir, there are many patients with lung fibrosis after post-COVID complications. Is there any role of physiotherapy?
So fortunately, post-COVID patients, even during COVID also, we have treated many patients, and it has significantly improved the patient's condition. And now because of post-COVID complication, not even AV and even lung fibrosis has also increased. And definitely, sir, breathing exercises, we have a chest physiotherapist, even at Noble, we have now created a separate section for cardiopulmonary rehab. So now I have 3 to 4 postgraduates who are just seeing the post-COVID complication and cardiac cases. And it is physiotherapy and one of this machine, what I've told you, the magnetotherapy. This, the combination of physiotherapy and the magnetotherapy has improved condition of lung fibrosis. Okay.
Thank you very much, sir. Actually, for better prognosis, role of physiotherapy is very much needed. So thank you very much for the best guidance. Thank you once
Thank you,
again.
thank you, and thank you HMA for giving me an opportunity once more.
Thank you very much, sir, for sharing your deep knowledge about recent advances like shockwave therapy and other modern modalities in physiotherapy with us. Your session was full of enthusiasm and valuable knowledge, sir. May I request Dr. Shubhata Joshi to felicitate Dr. Umar Farooq Khan, please.